Hello, hello, and welcome. Listen, let me ask you something. What are your thoughts on nursing home care? Like nursing homes, what are you thinking? What have you heard? Because the streets are always talking and they're always saying something. So, what have you heard about it? Is it something that you would consider for yourself or for your loved one? Probably not. Let's just be honest and call a thing, right? You are probably like, nope, not going to happen. And the reason why I know this is because the majority of people that I encounter say, nope, not going to do it. That is not what's happening. That's not what we're going to do. However, what I've noticed is that a lot of families find themselves in this situation, including my own. We also had to make a decision and say, what is the best decision overall for everybody in this situation? And that is what I want to help you today. That's what I want to help you do. I want to discuss some of the benefits of nursing home care because there are some benefits. So let's talk about those benefits. But then I'm also going to talk to you about some of the tips that you can use so that way you can make the best decision for you and your family. Welcome. If this is your first time joining, I'm Dr. Ashley Booth. I'm a board certified family medicine physician. I'm also the owner of Healing Beyond the Stethoscope Primary Care located in Savannah, Georgia. And I provide practical health tips and tools that you can use in your everyday life. If you haven't already done so, make sure that you go ahead and subscribe and share and tell the people because somebody is going to have someone who needs this discussion because we know that our population is getting older. We are going to need some assistance and some help. And so we need to know what we need to do. Also, let me know if you're watching, just say a hey, a shout out because I will always get back to you and say hey. And then let's go ahead and get into it. Okay. So, one of the things that I used to hear a lot was, you keep acting up. And when you get older, I'm going to put you in a little nursing home or I'm going to put you in the home. And everybody would laugh and ha, ha, ha. Right. But once I realized that, I was like, oh, the nursing home is not where you want to go. That's not the place to go. And I know a lot of people are thinking that. And some of the reasons why people don't want to go there, don't want to do that is because look at the ads. Look on TV, right? And you see all the things. Or people, we always have people. Somebody told me X, Y, and Z happened. And the things that they're talking about is nursing home neglect. People are having falls, their bed sores, it's dirty, there's a rude staff, or staff are harming the residents, like all of these horror stories about it. So it's like, nope, not signing up for that. The other thing is you feel like you are abandoning someone, and that can lead to a lot of guilt. So it's like, no, because I can't do that because of, the issue. The other is family. We are a family. We should be able to do it. We're going to all band together and we're going to do it. But what I've noticed is with that family, usually there's one or two main people who step up and are there all the time. When I say all the time, who are 24/7 all the time. And then you have a couple other people who kind of show up here and there, right? So we have to think about that when we talk about and be careful when we say, well, we're a family. The other thing that I've noticed, and hear me with this one and understand this one, you're weak. You are weak, or you are not a good child or good relative because you did that, right? Because you were supposed to take care of the person who took care of you, the person who loved you, the person who was your family. So when you don't take care of them, then there's something wrong with you. Like, why didn't you step up? But the question that I have is, what does that care look like? Because you said, well, they took care of me, so it's my turn to take care of them. Okay, I understand. But what does that care look like? Because a lot of times what happens is when you start taking care of someone, and a lot of times these situations show up when you're not, they don't just say, hey, this in May of 2036 is going to be your time to take care of this person. Mm-mm. It shows up. It just pops up and it says today is the day, and you have to decide whether or not you are ready for it, right? No matter what is going on in your life. And so because of that, it could lead to you being really stressed out, tired, overwhelmed, because you always have life and life is life, and right? So then all of that is what could be happening to you. And when that happens, That care does not look pretty, because that care is going to lead to caregiver burnout and caregiver compassion. Well, they also call it compassion fatigue. So you can have caregiver burnout, or you can also have compassion fatigue. And that is a real thing. Hey, thanks for watching. I see you out there. But yeah, those are the things that can really happen because of all of these things that are going on with you. You're stressed, you're overwhelmed, and all of that. So before we start to throw nursing homes and let's start to explore some of the benefits. So the very first thing we have to think about is safety, because falls are the number one cause of injury and death in people over a certain age. And I talked about that months ago, about how we start to lose our balance over the age of 40. Over the age of 40, you start losing your balance, and you're not able to stay up straight. So the older you get, the more likely you're going to lose your balance. You're going to have a fall. If you have a fall, who's going to be able to be there to help you get up? That's what we have to think about. If your loved one has a fall and you are not there to help them get up, how long are they going to be there before somebody can render aid? And they could have a broken hip. They could just have fallen. Then they can't get up. A lot of other things can happen. So when they go to the nursing home, one of the things is it can help with the safety of falls, because it can help prevent them, because they have certain things in place. They have the bed railings. They make sure that they or certain things are locked if they're in the wheelchair, any of those kinds of things. But the other thing is, if they do have a fall, because I'm not saying the nursing homes are perfect, right? They try to keep their eyes on everyone all the time. Things happen. You turn around for a second, things happen. So the other thing is going to help prevent those falls. But then if someone does fall, there's a response. So someone is there. So if they fall, it shouldn't be a long period of time before someone says, oh, Miss So-and-so fell. Let's get them back in the bed. Let's assess them. Did they hurt something? Let's call the ambulance to go ahead and get them to the hospital. Whatever it is, but they know what to do, and they should have a protocol in place to make sure that your loved one is safe. The other thing is 24-hour care and assistance. And when I say 24-hour, they have someone there on the clock 24 hours who should be looking after your loved one, making the rounds, checking in to see what is going on. Because I know that we have Peanut in them who said they're going to drop in here and there, but anything can happen in 5 minutes. Anything can happen in an hour. All of that. I've had some people tell me, oh, yeah, well, I have someone with mama for a couple of hours, and then somebody else is there for a couple of hours while I'm at work. And I'm like, well, what happened to the other 4, 5, 6 hours? Well, we have to be careful. So there is a 24-hour assistance. So they have somebody who is checking in on them at all the time. Community. The other big thing, the number two thing that you're going to get from the community, the nursing home, is community. And a lot of times we don't think about that, but now they have somebody they can interact with, somebody they can talk to, not only just the other residents that are there, but staff. Just seeing people walk down the hall actually stimulates your brain more than just watching TV, because sometimes people are just kind of sitting at home and they're watching TV, and somebody might come in from time to time and check on them. But actually being able to get out into the community center and play checkers and bingo and all that kind of stuff, that helps to make them stimulated. It keeps them more active, because they also have some little activities that they try to engage with them and help them play. It helps with isolation, because if you are alone all the time, you are like in an area that you're not getting a lot of fresh air, you're just kind of sitting there, that can lead to poor health, because isolation and lack of socialization can lead to poor health, and that can also lead to more decline in your health. So you're going to get that community aspect. The other thing, the third thing, is personalized care. So if someone has like dementia, the one thing that I've been seeing a lot is a lot of older people who have a history of dementia or memory loss, and there's these alerts that go out, we can't find them, and it's because they were at home and somebody may have taken their eye off of them for a second. Well, they have some memory care units. Some of these nursing homes have memory care units that are specific for these types of people. They know what types of locks to use, they know what type of activities to use. They have other things set up in place, so if they go too far, they go over here, this is how we can redirect them, all that kind of stuff. There's rehabilitation. So if someone, let's say someone was bedbound, right? and they need to make sure that they still keep their strength up, then they can have physical therapy to come in and move those limbs while they're in the bed so that they can get things moving, so that they can still remain as strong as they need to. So we need to think about some of those personalized care thing options that they have. The fourth thing are the daily activities, having some support with that. And those daily activities is putting on their clothes, taking a bath, going to the bathroom. That stuff is a lot, right? Because if you have someone who needs assistance getting up from the chair and getting out of the bed and go, you have to put them in a wheelchair or bedside commode, anything, that is physically taxing. That is a lot. And so they have some people or equipment that's in place who can help safely move them. Because that's another issue with the fall, is because you can pick somebody up, you get ready to put them down, they move the wrong way. That also can hurt you. So now we have some support with all these daily activities so that way they can still be in good health. And you're right. I see someone that made a comment and said that certain communities do not believe in nursing homes. So that is absolutely true. And that's one of the reasons why I want you guys to start thinking about these different things, because I have a lot of people who are like, I don't know if this is the right decision for me. So let's think about it. So I'm go through the benefits again. We have safety, community, personalized care, and then support for those daily activities. So when you're thinking about making this decision, the thing that you want to do is start having the conversation now with your mom, with your grandma, with your parents, with everybody who's going to be involved. And we need to talk about what are your wishes and what do you want to happen, right? Because at the end of the day, we have to make sure that your needs are being met, and all of your needs, your emotional needs, your physical needs, your mental needs, all of those things have to be met. And if that person, if you are not going to be able to meet all of their needs, then we have to start thinking about, well, what else is out there that can help assist us to get what we need. The other thing is determine what can you do realistically with your village or without your village, because there are a lot of people who will show up, and they might show up for a week or 2 weeks, but who is in it for 3 years from now when this happens? 5 years from now, if this person still needs assistance, who is going to be with you consistently 24/7 to make sure that this person is safe, right? The other thing is look for some resources that are available to you. So you can look at the insurance. What does the insurance cover? Will they cover a nurse coming into the house for those hours when you're out? And then the next thing you say, oh, okay, well, they're out. They're not able to do it. So then, or they can cover while I'm at work. So then once I come home, I'm able to do and watch them or whatever. Those are the things you want to make sure that you look at, right? Then you want to look at, I actually just found this out. There are elder lawyers, elder law attorneys. That's what they're called. Elder law attorneys. And they talk to you and they let you know what resources are available. They also will let you know if you are at risk of having like neglect for someone. So this is the thing. If you have a loved one that you know is not able to get out of the bed, they cannot get out of the bed by themselves. Let's just say, God forbid, a fire breaks out. Who's going to help them get out of the house? And if someone knew that you left this person in the house alone and they could not get out and a fire happened, you could be liable depending on the state. So these are the things we have to start thinking about, because people don't know, oh, well, nothing fires and things happen all the time spontaneously. We never know what happened, what triggered it. But that's like a big thing. Who's going to be able to know and help get out? I know I talked about the falls, but we have these other things. So these lawyers, the elder law attorneys, can help you determine, like, okay, are you going to be held liable, criminally liable for this? But also they can talk to you about some other resources that may be available to you that you could probably use to help supplement a lot of this. The other thing is start looking at, what are your options? Do we need to do long-term care? Do we need to do respite? Respite is just like a short-term thing. You say, okay, I need a weekend. I need a week, whatever. You can do that. There is a hospice facility here in town that accepts people for respite care. These people are not on hospice, but they come in and use the facility, and their loved one stays for a day, 2 days, whatever. It allows the family a chance to start doing some of those things that they need to do. There's nothing wrong with needing a break. Nothing. As a caregiver, you still need a break. There's nothing where you need to refresh and renew. Because if you think about it, if you are a parent, you love your children, but you may not be with your children all day, every day. And it's like, okay, if they are at sports for a couple of hours, if they're at school for a little bit, whatever it is, you need that time away so that you can be yourself, have your own thoughts, whatever, and then come back. So that's the other thing that you want to think about. So, do I need long term care? Do we need respite care? We need assisted living? They're able to do a lot of the things, but I'm still concerned and they need an eye on them. But, it's not like that full term, like a nursing home. So, start thinking about, okay, what is going to make the best sense for everybody? And then the last person that you're going to talk about, I always talk about, because I am a physician and a primary care physician. You want to talk to your primary care physician about this. This is someone who can help you navigate this, and they can say, "Hey, this is what's going on with mama. This is what's going on with Uncle James, whatever. What do we need to do?" And especially if this is their patient, because then they can say, "Okay, yes, he has sustained a lot of injury. He's probably not going to be able to get back out of the bed anytime soon. So a nursing home would be appropriate." Or, "Oh, he's getting around great, but I'm starting to notice this." Or, "I did this memory test on him and I'm noticing that the memory is declining. You guys need to start setting up some things in place." But you want to get with the primary doctor because, one, they can make that assessment, and then two, they can start helping you make the decision. You get that information, put it together, and then start having the discussion with the family. And like I said, you guys want to start having this discussion now because it is an emotional one. I'm not going to deny that. Like, making this decision can be a lot, but you want to do it when you have a clear mind and you're not so emotionally invested, and you're able to just be able to, like, okay, I see the pieces and I'm not too emotionally into it, versus I'm really upset because all of these things happen and now I don't know what to do, and you're overwhelmed. So let's start having these conversations with your family, having them with your primary, so that way you can make the best decision for you and your family. Until next time, I'm wishing you much, much healing, and I hope to see you soon. Take care.